Hi, my name is Dr. Alan Mitha, and I'm an Associate Professor of Clinical Neurosciences and a cerebrovascular and endovascular neurosurgeon at the Foothills Hospital in Calgary, Alberta, Canada. My team and I are currently working on improving surgical outcomes for patients using stem cells for the treatment of brain aneurysms. Aneurysms are caused when small blood vessels in the brain break down and cause an area of weakness. This weakness develops into a balloon, and when this balloon ruptures, it causes a stroke, leading to death in up to 1 in 7 patients. Brain aneurysms are typically treated one of 3 ways: clips, coils, and stents. Stenting is becoming a very popular form of treatment because it is quick, less invasive, and generally has favorable outcomes. Using angiography, which is a type of X-ray, a small tube or catheter is navigated from the wrist or the leg up into the small blood vessels of the brain. Once the catheter reaches the right location, a stent is placed across the opening of the aneurysm to divert blood flow. This type of stent is a small metal mesh tube that redirects blood flow away from the aneurysm in order to reduce the risk of stroke. However, in 20 to 40% of patients at 1 year after treatment, the blood flow is not diverted properly, and patients may need to be treated again. Our lab is focused on using adult stem cells to reduce the number of procedures that patients have to undergo to heal the aneurysm the first time around.
Hi, I'm Brooke, the PhD candidate working with Dr. Mitha on this project. My job is to figure out exactly how these stem cells can improve aneurysm healing. Stem cells are a unique type of cell found all over the adult body. Found in your bone marrow, your fat, and your blood, among other places, these cells go to areas of inflammation, turn into the damaged tissue, and help secrete proteins that improve healing and make the body heal quicker. I isolate primary stem cells from fat tissue and grow them in culture in the lab. Once we have enough stem cells, we can freeze them to use at a later date. Our lab has shown that stem cells can help improve aneurysm healing and permanently close the opening to the aneurysm. Although we know they can help, we need to learn a lot more about how they're doing so before we can move into clinical trials.
This project has been broken down into 4 different budgetary groups. Number 1, stem cell materials. We grow our stem cells in special media that allows us to avoid things like rejection. Number 2, surgical materials. This covers the costs of things like catheters, stents, and medications for the study. Number 3, graduate student funds. This allows our graduate students to fully focus on the study without having to worry about their finances. And number 4, publication costs. In order for our work to get into the scientific world, we need to cover costs of publication like open access fees. The potential impact of this project is exciting because we know it can improve the lives of so many patients if moved into clinical trials.
Check us out on Collavidence to learn more about brain aneurysms, stenting, stem cells, and how we are trying to improve outcomes for patients.